The MP for Battersea, Marsha de Cordova, hosted a roundtable to speak with her local optometrists about the challenges facing the profession and what she can do to bring about a positive change. It was hosted at Karen Lockyer Optometrist in Clapham Junction.
I want to really hear from you guys what some of the challenges are, but also what you're doing locally as well to deliver good eye care. You know, since becoming an MP 7 years ago, it really has been my mission to improve eye health care and support for anybody living with sight loss. Due to my own lived experience of being born with nystagmus, I don't know any different, essentially. I only know what it's like to be severely short-sighted. That's why I am an absolute champion. I mean, what would be useful, I suppose, because we all are aware of some of them, but it'd be good to talk about what some of the challenges are.
It's very frustrating. I mean, we can have someone who lives in Chelsea and they can't have the NHS service, so they've got to pay privately. It shouldn't be postcoded. I think if you have an injury, you walk into a walk-in centre, you can get looked after. Why in the UK? Well, why in England can we not do that? It's a bit of a frustration.
So it's about consistency of service, isn't it?
Service delivery,
regardless of where one lives. And this is the problem, I think, with some of the way that services are kind of commissioned out.
So it'd be really good if there was that consistency across the board. One, so it's easy for the patient to be referred over, but also to make our jobs a bit more fluent in the care that we deliver to the patient. Because often there's lots of extra time and I think wasted, and I think there's better productivity of our time and for the patient, because it means that we can see more patients and our capacity can be increased if there was that coherency between that primary and secondary care area.
And what's the best way to do that? Have that interface? How would that? What should that look like?
Well, I think there's some early discussions around the digitalisation of referrals and making it more connected, not only in your local area but nationally as well. As someone who's from Birmingham, who's also then moved to Manchester, I can see how service delivery is varied in these three areas. What I would hope and what I envisage for the future is there to be more collaborative care in all throughout England.
You know, we're in this perfect position. Some of my patients will say I have better equipment than the hospital. So we could just do that. We could triage people. We have 2 consulting rooms. But obviously there's going to be a fee because we're a big practice, high street practice. What I want to do is deliver clinical excellence, and we can do it in the community. We do it in a nice environment. You know, I'm a very experienced optometrist, so I employ very experienced optometrists. So we're all able to read OCTs and Optomaps.
One of the things that we probably all know is that obviously the waiting lists are huge, the backlogs are huge. Eye care is one of the largest waiting lists and backlogs, which when you tell people that, when you say that to a minister, that they look surprised as if they didn't know.
You'd be really surprised to hear the amount of we have a lot of DNAs that do not attend to the appointment because when they come up to the following appointment, it's because they didn't have the capacity to come in. They didn't have a family member or a friend who could take them, or they simply just weren't feeling well. But if it was just a short trip locally, that would be more helpful for them.
Well, it's how to make best use of the resources that we have, isn't it?
Yeah.
Particularly in the community. And this is where you guys really have such a strong role to play. And one of the questions, so you talked about, for example, South East London, where they have this, obviously the digital referral process, and that seems to be working. Obviously, that's a separate ICB, but I'm just trying to understand, and just be honest with me, why is it that South East London can do it but South Western? Is it based solely on funding?
So I am not entirely sure about the situation of
I'd love to
funding in South East
understand,
London, but I know in South West London the deficit is just growing. The best thing is the Optometry First module. So basically with optometry, seeing things first, and that would free up so much time in ophthalmologist clinics. But obviously that does come at a cost.
I think it's the wider issues around how they prioritise funding for eyes, which it just doesn't attract the same level as for other diseases, and then therein lies the issue. But I think in terms of how for example, we could negotiate the best kind of relationship with the Optometry First model is something that needs to be looked at closely. How do we fix it?
There's 2 things. Digitalisation with the electronic referral system. I think that's the most approachable and easiest thing that we can do. It just needs a bit of investment. But also, as we make a move towards kind of artificial intelligence and systemic analysing data to increase the capacity of the patients that we can see, and a lot of remote care as well. We're seeing a lot of more remote care and also home monitoring. I think that's the area where that innovation can come in. And so just a bit of investment into these areas.
How would that look, some of the remote stuff? I mean,
so there's some, for example, in glaucoma, you might need to measure eye pressure. There's lots of technology that's already out there that can just measure that at home, and it will automatically send it to the to the clinician. At Moorfields, we have some virtual clinics where patients, it's a technician-led clinic where patients can come to more satellite clinics, have their scans, and then it's sent remotely. At Moorfields, we also collaborate with Google and a DeepMind project where we're looking at scans, optical coherence tomography scans, where we can detect eye disease a lot earlier. And so that's more of obviously being funded privately. I'm not saying that NHS and the government need to fund all of this innovation, but a little bit, I think, would go a long way.
So I think the main issue with ophthalmology is just that the waiting times are obviously so long, but there's also so many things that we can do as optometrists to try and alleviate that. Thank you. With the stable conditions, we do have the knowledge to help with that, and then filtering out new referrals. So like the queue system is great. Along with that, just simple service of queues, if we added in doing OCTs, then we could alleviate the referrals for suspect wet AMDs. And if we added in IP, then for things like recurrent uveitis, corneal ulcers, rather than going and sitting in a hospital clinic, they could get that medication from an optometrist that is so much closer than any of the hospitals.
Quicker. More joined up.
Yeah,
it's just literally.
Yeah,
and that's the key.
We have all of this knowledge, but we can't do anything with it. It's really frustrating.
That's come through, hasn't it? The amount of knowledge that you guys all have in the community, and it's just not being used. It's not being exhausted at all.
Queues would help so many people. So it'd help the GPs, it'd help A&E, it'd help ophthalmologists. All the three people that essentially we will
benefits
talk
of it
about. Is
really
just,
do outweigh.
But a lot of patients will stay often for years and years, and I'll see patients, and we've recently gone to electronic record a couple of years ago at Moorfields, and I'll look back at the records and it's just, and they've been stable, and I'm thinking, what are they doing here? They could be seen in their local communities, and a lot of them, I had a patient this week actually coming up from Oxford, and I'm like, gosh, you could, and that happens a lot, people could be seen in their local areas, but they're coming here, and that our time would be better spent seeing more local patients, more urgent cases.
And that's probably because one of a few things really, isn't it? I mean, it's there's not that joining up with their local providers, and also there's this element of them not being able to see someone in the actual community as well, isn't it?
The patient I saw, and she was with her husband, and she was pleading with me, it's real difficulty for me to get here. I booked a train, I've missed it. How am I going to get back home? And all I could say to her was, okay, we can write to your GP, and your GP then has to ping pong you to Oxford Eye Hospital. And I can't send all your files just like that on an electronic record system.
I think this is the thing, isn't it? And one of the things that was quite striking for me was just how little attention was given to eye healthcare and the amazing opportunities that there are, i.e., joining up primary and secondary care, and just the benefits that it will bring, and nobody's really tapping into that. And if it is being done, it's not being done in a consistent way. So even in London, with all our 33 boroughs, and okay, it's broken down into regions, but South East London's doing something very different to South West London. I mean, the mind boggles in that respect, but that is exactly what's happening just because of the way that, funding is being delivered and administered. So I think for me, it has to, we do need to look at this in a more consistent way, which is why I brought forward my plan and my bill to try and alleviate some of that, creating a better pathway and joining up primary and secondary care, looking at the workforce, because our all-party group, we led a whole session on the workforce challenges, and we had the colleges in, we had AAP, everybody said the same thing pretty much. And what was quite striking for me was everybody is willing to kind of, people weren't being territorial about their spaces and their expertise because they recognise it's for the benefit and the good of the patient at the end. But obviously speaking to the points around digitalisation, but also the opportunities that could come with artificial intelligence as well, because I'm quite sceptical about it in some cases, but also I think we have to look at it in a broader way as to see what could work for us. So, there's a lot of work to be done. That's why you need a national plan.
Indeed, it is.
That is why you need a proper plan in place it's a national plan, but it's obviously implemented and delivered locally so that there's a consistent approach and everything is joined up, and also obviously with the right funding attached to it as well.